Kwekwe Tanse Unusakut, hello et bonjour. First, want to acknowledge that I am joining you here today from the traditional territory of the Algonquin and Anishinaabe people. I'm joined here today by Associate Deputy Minister Valerie Gideon and Deputy Chief Medical Officer Evan Adams, sorry, online. So great to have him here today offering an update on Indigenous communities. I would like to begin by thanking once again Indigenous leadership across the country. So much has been done in terms of organizing logistics for delivering vaccines, educating community members about the safety of vaccines, and keeping people's morale up during the crisis. And this week's COVID-19 case count once again reflects the hard work. As of April 6th, First Nations communities on reserve in provinces were aware of 635 active cases, which is once again a decline from last week. This brings us to a total of 25,174 confirmed positive COVID-19 cases, with 24,249 cases recovered, and tragically 290 deaths. Continued uptick of vaccines with Indigenous communities is a large contributing factor to the decline in active cases, in addition to the continued respect of public health measures. As of April 5th, 257,279 doses have been administered in 612 First Nations, Inuit, and Territorial communities, representing 60% of Indigenous adults in First Nations and Inuit Nunangat. Earlier today, the National Advisory Committee on Immunization released its full statement on its extended dose interval recommendation. The statement provides the detailed evidence and complete analysis that supports the recommendation to extend the time between the first and second dose of COVID-19 vaccines of up to 4 months. Extending COVID-19 vaccine dose intervals will optimize early vaccine rollout and population protection. It will do this by allowing many more people to gain protection against severe COVID-19 outcomes, since they will receive the first dose of an effective COVID-19 vaccine earlier. Présentement, plus de 60% des adultes.
Currently, over 60% of adults have received at least a single dose of a COVID-19 vaccine in First Nations communities, Inuit, Nunangat, and the Territories, and over 70% of the adult population have been vaccinated in the Territories. In BC, all eligible relevant residents of First Nations communities have been offered their first dose, a major accomplishment. And in Quebec, all First Nations communities have started vaccination clinics, and 4 communities have started their second dose clinics, with the rest set to begin in the coming weeks. Now, while these milestones are encouraging, we must remain vigilant. The recent lockdown measures in Ontario, BC, and Quebec remind us that the pandemic is not over. Variants of concern, which can spread more easily and make people even sicker, are increasing quickly. Everyone still needs to wear a mask in public. Wash your hands regularly or use hand sanitizer regularly. I know that these have been extraordinarily difficult times, and in the pandemic, we've been there for each other. So check in on the people you love to make sure they're okay.
As well, to take the opportunity today to say a few words on Child and Family Services. The Government of Canada is continuing the important work in full partnership with Indigenous peoples to reform Child and Family Services so that every Indigenous child has the opportunity to grow up in their communities, immersed in their cultures, and surrounded by loved ones. This is why last week we announced the launch of a call for proposals to support Indigenous peoples, communities, and groups as they begin work to develop their own legislation and explore Indigenous-led models for child and family services. More specifically, the funding is intended to provide support for Indigenous peoples, communities, and groups wishing to explore models and options to exercise jurisdiction and develop Indigenous child and family service legislation systems and programs prior to entering into tripartite coordination agreements, discussions with federal, provincial, or territorial governments as applicable. The funding is critical to supporting First Nations, Inuit, and Métis communities who want to use the Act to both affirm jurisdiction, advance new models of child and family services, and ultimately will support more Indigenous children and families being able to stay together. Through the July 2020 economic statement and fiscal snapshot, the Government of Canada committed over $542 million over 5 years starting in 2020-2021 to support the implementation of the Act respecting First Nations, Inuit, and Métis children, youth, and families in full partnership with Indigenous partners. Of this investment, a total of $425 million will be allocated over 5 years in capacity building funding. As communities develop their laws, specific funding will also be made available for their participation in tripartite coordination agreements to further advance these models. These discussions will be essential to reaching agreements between Indigenous communities, the Government of Canada, provinces and territories to provide services to children and their families, and they will also ensure a smooth transition from the existing system to the one envisioned by Indigenous communities free from racism and discriminatory practices. By supporting family preservation, we're also supporting language preservation. Strong family connections ensure continuity to Indigenous cultures, traditions, and languages for generations to come. Pour conclure, aujourd'hui, nous célébrons aujourd'hui.
In closing, I'd like to highlight that today is World Health Day, and this year's theme is building a fairer, healthier world for everyone. COVID-19 has highlighted the widening gaps in healthcare that often leave First Nations, Inuit, and Métis communities underserved. The COVID-19 pandemic has pushed more people into poverty and food insecurity and has amplified gender, social, and health inequities. This World Health Day is a call for action to eliminate health inequities as part of a year-long global campaign to bring people together to build a fairer, healthier world. I'd like to reaffirm my government's commitment to reducing the gap in health status between Indigenous and non-Indigenous peoples. And every person, whether they're First Nation, Inuit or Métis, deserves to have the same level of quality health care as any other Canadian. To have quality health care be accessible and delivered within the communities, to have it relevant and be by integrating spiritual, cultural and traditional ways of knowing, and to have it be fair and respectful without the influence of racism or discrimination. We will continue to work with partners to close the gaps in health, education, employment, gaps that currently hold back too many Indigenous people from achieving their full potential and contributing fully to their communities.
Merci, Cho. Thank you. Over to you, Evan.
Thanks very much. I'll just quit from the unceded territory of Tla'amin First Nation, which is near the city of Vancouver. As of April 6th, there are now 635 active cases amongst First Nations on reserve, which continues a 10-week trend of declining numbers of new COVID cases. And where new cases, sadly there have been 290 fatalities. The case fatality rate is less than half of that of Canada's general population. We continue to have good success with vaccinations in First Nations communities, with over 250,000 doses administered in 612 communities. Now over 50% of adults living on First Nations reserves in Inuit and Nunavut and in the territories have received at least one dose. I personally would like to acknowledge the resilience of our communities and community members and of their leadership and the ongoing collaboration of communities with provincial governments and the federal government, and with all of the many workers who are tasked with addressing COVID-19. Canada has received 10 million doses of COVID-19 vaccines, and that will continue to increase over the coming weeks and months. I'd also like to mention the Battleford Agency Tribal Chiefs Inc. and the Saskatoon Tribal Council and Prince Albert Grand Council in partnership with the Saskatchewan Health Authority and Indigenous Services Canada are running mass immunization clinics in North Battleford, Saskatchewan, and Alberta. The clinics will have the same eligibility criteria as other SHA sites, with an emphasis on urban, off-reserve First Nations people. In Manitoba, Long Plain First Nation has begun mass vaccination. Chief Bennis received his vaccination and noted he took the vaccine to be an example for the elders and for the people in their community. Imut, thanks very much.
Thank you very much. This is what concludes today's speeches. We will now take questions from the journalists. One question, one follow-up. Nous allons maintenant prendre les questions des journalistes, une question suivie. We will start by questions on the phone. Nous allons continuer avec les questions au téléphone. Opérateur, c'est à vous.
Thank you. Merci. Please press *1 on your device's keypad. If you have a question, faites étoile 1 si vous avez une question sur votre appareil. Faites étoile 1 sur votre appareil. The first question is from Jamie Pasha-Gumscombe from APTN. Your line is open.
Hi, yes. Thank you, Mr. Miller, for taking our questions. I'd like to speak a little bit on hesitancy. In the past couple of weeks, you said that there are no indications of vaccine hesitancy in Indigenous communities. And if I could go to the Cree Nations in Quebec, where they said they have a 77% uptake, which is really good. But there are pockets there, for instance, like the First Nation, the Nemiska First Nation, where you see the uptake is rather low. Now, are you aware of any other cases? There's cases such as this, because they're reporting that some doses are getting wasted. Could I have your response to that, please?
Yeah, and thanks, Jamie. I'll ask Dr. Gideon or Adams to complete my thoughts. What we've seen in the aggregate on the whole is really exemplary work across Canada. High uptake in communities, going as high as the high 90%. It's a testament to the work that's been done by Indigenous leadership to get as much information into people's hands so that they can make a choice, and the choice is overwhelmingly yes to get this vaccine. Indigenous communities have known from the get-go the odds that they're fighting, overwhelming odds compared to non-Indigenous communities, and they're answering the call when it comes to the priority deployment of that vaccine, Jamie. There are pockets. I won't deny it. We shouldn't deny it. But what we've seen is when we work with those communities that for one reason or another have a level of caution with respect to the vaccine, we see really good work that can come from it, and then people coming back and deciding to take the vaccine. But it goes through a respectful engagement, making sure that Indigenous health leadership is at the forefront of the decision-making process, and making sure that that offer is there. And so I wouldn't say I'm not worried, but I'm very, very optimistic about some of the work that's being done to make sure that people are protected and that they're protecting those that are most vulnerable. Valerie or Evan, I don't know if you want to complete that.
Sure, I can share. We do, excuse me, regularly connect with our Deputy Minister colleagues from provinces and territories to check in. And as the Minister noted, we are seeing in some provinces and territories that they're going in sometimes 2 to 3 times rounds into communities to be able to build up trust and credibility. There are some discrepancies in some regions, like variations essentially with respect to uptake, particularly among the younger age cohort of 18 to 30-year-olds in some communities. But education is making a difference, and working in partnership with community representatives to address any questions or concerns that community members have, and giving some time, some space for people to make those informed decisions, and coming back to let them know that the opportunity remains for them and that support remains for them to actually be vaccinated is an effective strategy. Dr. Adams, do you have further thoughts on hesitancy?
Yes, it is an unfortunate reality that it is difficult to achieve 100% vaccination rates. It would be really nice if we could vaccinate everyone very quickly. We should expect some hesitancy and we should expect pockets of hesitancy because not all communities are the same. So, as has already been said, doing outreach and providing credible, reliable, reassuring information to those who are still on the fence, and continuing to give opportunity for vaccination is at the heart of the work. I think what we're seeing now, we did worry for a while. I think we were worried that there would be a lot of hesitancy. It doesn't seem to be quite the case. I would say generally our vaccinations have been quite highly accepted, and we would like to continue to do better. And we mean that for all Canadians. I think it's really important as well for Canadians to speak to trusted sources, to family members about their concerns so that we can air them, so that we can learn from them, and they can make decisions that they can live with.
Did you have a follow-up, Jamie?
Yes. I guess I could follow up by asking, you're saying that the cases are declining in First Nations communities. Now, what is accounting for this?
I can begin.
No, go ahead, Doctor.
Go ahead.
No, please. You're the doctor.
Oh yeah, the number of active cases has been dropping, and as I was trying to say earlier, the number of people who have gotten better has been outpacing the number of people with new infections. That's been extraordinary, and there has been a drop. We've been quoted last week as saying more than 80% from our highest point in mid-January, but we're actually closer to a drop of 85% now. And we think that these low number of new cases must be related to our early work in getting First Nations people vaccinated. Of course, it's a number of other factors as well, but it certainly must be related to our success at vaccination.
And to add to that, Jamie, I mean, there is a strong correlation to the early vaccine deployment in Indigenous communities, and probably very strong causation. But you can't underplay or underestimate the work that the Indigenous leadership has done to deploy all the public health measures in communities to really drive down the 5,000 active cases that we saw in January to what is about 600 right now. It's really amazing work. It's not one single factor for sure. It's nice to see those vaccines getting out and getting high uptake, but those public health measures are playing a role, and those public health measures do come with a cost. So I don't want to underestimate the work that's been done in making sure those get and continue to be observed.
Thank you. Merci. Prochaine question. Next question.
Thank you. Merci. Next question is from Willow Fiddler from the Globe and Mail. Line open.
Hi, good afternoon. So in terms of the vaccine rollout, we're kind of in Ontario seeing this disarray happening with the general public. When you speak about the success that you've seen in the First Nation communities, and we've seen this with Operation Remote Immunity in Orange, what can be learned from the effort that we've seen from the First Nations leaders? And is the department doing anything with that information, with those plans, how will that be used for future work for whatever reasons?
One of the takeaways that I hope we don't forget coming out of this pandemic, Willow, is that if we trust Indigenous leadership, and in this case, health leadership, the outcomes are better. Now we have proof points. It isn't something that anyone can hide from because we have the facts in front of us. We know that when we work together for a cause that is common, the outcomes are better, and the trust is better when we trust the people on the ground that know best how to protect their people, in this case from a historic pandemic. That hasn't come without challenges, for sure, and we keep learning as we go. One of the important learning points that we faced in late November, for example, is shortening down the reaction time between when a community, through no fault of its own, becomes overwhelmed with COVID, the reaction time where we start deploying extraordinary measures such as the armed forces, if you close that reaction time from 5 days to 2 days, you prevent hundreds of cases of COVID. We're learning as we go. The work that Orange has been doing in Northern Ontario is amazing. It isn't even or identical as we go from province and territory to territory, and there are lessons to be learned on the go, but on a longer term basis as well as we look at the data unfolding in front of us. These are all things that it's difficult when you're operating in real time to reflect about the sort of long-term arc of the epidemic, but there are many lessons that we can learn from both successes and failures as we go on. I don't know if any of my colleagues want to offer any thoughts, Valerie.
Sure, I would. Thank you for that, Willow. And we do have, I think we've mentioned a few times, a federal, provincial, territorial Indigenous vaccine planning working group that has been meeting since the beginning on a weekly basis and really share what's happening across the country. And there's a specific urban focused working group as well. So people are sharing their best practices, and we are documenting what is happening. You can probably see all the papers around me on a regular basis, but we have a national plan that is really intended to tell the story of how things we were planning would unfold, and now updated to say how things have been unfolding and will continue to unfold. And we do hope that all this information will continue to guide not just immunization efforts, but also overall emergency planning and health responses. The collaboration with provinces and territories is absolutely fundamental to success. And also being able to be heard by the expertise of medical officers of health across the country, of the National Advisory Committee on Immunization, has also made a substantial difference from what we've seen in previous pandemics. And then I would just say that, from the positive stories that have been told by Indigenous communities, on Facebook or through various media, you can tell that there's a very personalized approach to the effort. So people are not just demonstrating their own ownership over the success, but they are also making sure that the time has been taken for people to be oriented to it. I think one of our colleague Indigenous physicians has talked about it like a bit of a Disneyland tour where you greet people and take them through the process. You offer food, you have artwork and teachings and information in their language, and it is a different experience. It is a very human experience that people are having in this context. And so they feel safe, and they also feel valued because they have been prioritized and because their community has had the space and the opportunity to demonstrate that leadership.
Do you have a follow-up, Willow?
Yeah, I'm just curious, what kind of data is the department tracking for the vaccines in each community? I understand the communities that are being serviced by Operation Remote Immunity, for example, aren't submitting their data to the provincial COVAX system. So I'm just wondering what ISC, what kind of data are you guys getting from the communities as they administer their vaccines?
I'll start, Willow, and then perhaps Dr. Giddy can complete. It's through a variety of means, through the working tables that we have with the provinces and Indigenous communities, as well as through open sources. It isn't perfect. It is by no stretch of the imagination perfect, but it's something that we are trying to calculate in real time to get a sense of what is penetrating into a community and their relative level or percentage of vaccination. It's key not only to longer-term policy that you alluded to earlier, but real-time action and reaction with respect to perhaps communities that aren't as where the uptake isn't as great, or perhaps that have higher youth proportions of the population, which is a growing challenge, obviously, which hopefully will be met with an enlargement of the vaccine dose to younger age groups. So it depends again by province. Manitoba has a robust reporting system that is reliable, but it is something that we're working on in real time and gathering and collating and putting together. So we can expect in the next couple weeks that for this data, quite frankly, to lag a bit as the mass vaccination deploys throughout communities. But again, we're quite confident in that 50 to 60% number of Indigenous people, adults on reserve or in Inuit Nunangat that have had at least the first vaccine. Again, knowing that is uneven as it spreads out in different communities or throughout the province.
I would echo the minister's comments. I think, we do, it's a balance of also respecting the different approaches of communities. So, for example, the communities under the Northern Intertribal Health Authority in Saskatchewan, we're not receiving sort of community breakdown data with respect to vaccinations, but we will see aggregate numbers, right? And so, but it does speak to the importance of continuing to work in collaboration with provinces and territories to disaggregate the data that they do have, because so that we can know, for example, in some of the larger urban centers, how many Indigenous individuals have been vaccinated. So that is information that is very difficult to get to if there isn't a collaborative effort that involves the provincial or the territorial government. Dr. Adams, do you have further thoughts?
Yes, I think it would be a phenomenal legacy from this pandemic for us to have a real-time public health data collection system for Indigenous peoples. And it is actually quite reassuring, the functionality of those data collection systems in certain provinces, for sure. There's still some work to be done for it to be perfect, but it is really an accomplishment to see almost in real time the number of vaccines going to Indigenous people currently. So I am quite proud of the collection that's been happening at a community level, at a regional level, at a provincial and territorial level, and gives us a view into how it's going in communities. And I think our communities see the value in participating, in cooperating and collaborating, in sharing their data, because they want to know themselves, how are we doing?
Thank you. Merci. Prochaine question. Next question.
Thank you. Merci. Next question is from Zach. Oh, just one moment, please. We got a question from Zach Vicero from Saskatoon Star Phoenix. If you want to ask a question, please press star 1 again. Okay, so he canceled his question. Back to the floor.
Hi, we'll now take questions from the room.
Good afternoon, Mr. Miller. Ismail Hamidi with the Canadian Press. Almost a year ago, you acknowledged that it has been hard to measure the impact of COVID-19 on Indigenous populations because of a lack of enough data, especially among those living off reserve. What actions have you taken to improve this, and what kind of data we are still missing?
Yeah, and look, it's an excellent question. I think that when I made that statement a year ago, it was with respect to the testing process, and each jurisdiction having its own way of reporting and ticking a box when someone goes in to get testing. And the challenge then was to identify the prevalence of COVID among Indigenous communities, not only on reserve or in Inuit Nunangat, where we have a good sense and a good relationship with authorities to get an idea of who is Indigenous, as well as who is actually doing it. So we had a sense of what those numbers were. What we didn't have a sense was the positivity rates within Indigenous communities at the point of testing in non-Indigenous communities, so downtown Montreal, Winnipeg, Toronto, Vancouver, and that is one that is done by the province. And each province had their own way of identifying what constitutes someone that is Indigenous for that. And you could look at the different testing sheets. I've looked at every single one and how they report indigeneity or don't. It's confusing, and the data isn't necessarily good or reliable. It's gotten better through our relationships with the provinces, obviously moving in real time and getting a sense of how the pandemic is impacting people. I would say that the best authorities in reporting and collating, gathering that data are in Manitoba and BC, with different outcomes in other provinces. But that has informed our allocation of resources in real time as we get a sense of where those surges are occurring. We saw the surges occurring in Manitoba, Saskatchewan, and Alberta throughout the winter period, and still present now in terms of active cases. So while those aren't perfect, and as Dr. Adams mentioned, a national data gathering process is something that would be ideal, but it is a tremendous amount of work. This same sort of process repeats itself with respect to the deployment of the vaccine. We have relative certainty in and around what is occurring, quote unquote, on reserve or in the far north, less so in urban settings. And that is that goes to the whole process of, do you have to identify yourself when you go in to get your vaccine, or is it simply because of what your age group is? So that remains incomplete, but we're hopeful to get a better sense of things as the vaccination process goes on. And again, it's always a plight for more data, better quality data, to be able to react in real time.
Thank you. There has been a lot of, like you said today, and Dr. Adams actually confirmed that cases have been declining in First Nations community on reserve. I wonder what's your message to those living on these reserves, and wondering when they will get back to some sort of normality. When do you think, are you confident that's going to happen soon?
As I stated earlier, this whole process of getting vaccines into Indigenous community is one that's foremost driven by science. It's driven by the fact that Indigenous communities are fighting overwhelming odds that COVID presents to them, and we've cited numbers time and time again that range from 3 to 5 times the incidence or propensity to get COVID, principally because of housing or health outcomes that we've talked a lot about. That's been driven by the science. We've reacted as a government accordingly. I'm actually very proud to be in a country where Indigenous communities have gotten vaccinated before me or the Prime Minister or anyone in the cabinet under 70. That's something I think Canadians should be all proud of. There's a lot more work to be done, and when we talk about when we can relax the public health measures, this isn't the time to talk about it. We still don't know how long, the vaccine will protect people. We don't know what it does on the incidences of asymptomatic transmission once you have the vaccine and perhaps contract it but have less severe outcomes. So there's a lot of unknowns there. And until we know or have a better sense of things, we need to adhere to the public health measures that are getting even more stricter as we speak in Ontario, for example. So too in Indigenous communities. But they know that. And so the message that we've had for Indigenous communities is to trust your health leadership, because that's the most trustful source of recommendations. To your initial point with respect to the penetration of the vaccine into Indigenous communities, it is still and remains uneven across the country. We want to obviously get to 100%, but this is something that we won't stop until we get there, and that's sort of the way that I see it going forward. But it is a day-to-day continuous repetition of the message and relentless work in getting vaccines into communities so that everyone can get their first and their second dose.
Comment on this too, if that's possible. You think that Indigenous communities can get back to some sort of normality?
I think Was that question directed at me? I can't quite hear very well.
Actually, but I also
wanted
want
to
to
ask-
comment on this if that's okay.
Yes, I think we're all wondering what the new normal will be. I think the way that we used to live more than a year ago is now behind us, and we wonder what the new COVID reality will be. Maybe for generations to come. I am personally hopeful, and certainly Canada has not been shy to say that Indigenous peoples and their safety and their health and well-being are a priority in this country. And I think for some who are hesitating, they remember a time where they were not a consideration within the health system, and those are painful memories and experiences. So I do feel like it's a new day, and certainly proud of Canada and other countries who have said Indigenous peoples should be protected, and we will make that a part of our national pandemic effort.
Merci, thank you. This ends today's press conference. Ceci met fin à la conférence de presse. Bonne journée.